Hello everyone. In this video we are going to discuss about neonatal skull. So here I have a neonatal skull, and when you see it from in front you can clearly make out that the facial skeleton is very small, and it is said that it is in the ratio of 1:7 with the cranium, whereas in case of adult the ratio is 1:2. Now why it is very small, the facial skeleton? You can clearly see that the nasal cavity is underdeveloped, and there are underdeveloped frontal air sinuses. The maxilla is very small because underlying maxillary air sinuses are not developed. The teeth are not erupted for both upper and lower jaw, and so as the mandible is very small. See this. So overall size of face is very small. The orbits are also small. The ethmoid and ethmoidal air sinuses are underdeveloped, and so as you can see over here, the lower limit of orbit is almost at the same level with the lower limit of nasal cavity. See this. Both are at same level. Now when the maxillary air sinuses will start growing, specifically after the age of 2 years, the lower level of this nasal cavity or the floor of the nasal cavity will be bit low as compared to the floor of orbit. Let me show you the same in adult skull. So over here you can clearly make out the difference. Just see the floor of nasal cavity and floor of orbit. Another thing you will appreciate is presence of suture at symphysis mantis. See over here, the mandibular halves are not joined. See this. From below and behind also you can appreciate the suture line. So over here the width of the face at this suture will increase, the mandibular half will increase, and overall width will increase. Other suture which will help in increase in width will be this internasal suture, this frontal suture, okay, intermaxillary suture, then below interpalatine suture. So at these sutures the width of the face will increase later on. Similarly, there are front suture, the sutures at the pterion, at the squamous temporal, between occipital bone and mastoid. So these sutures will help in increasing height of the facial skeleton and overall height of the skull. Now when you see it laterally, you can clearly appreciate obtuse mandibular angle. See over here. Now the angle is in such a way that the head of the mandible is more or less similar with the level of upper border of the body. See this, they are almost at the same level, and gradually the angle will decrease just in case of adult. Just compare it with the adult mandible. See over here, the angle is reduced, and so as the height of head is more as compared to the upper border of the body. See this. Now when you see from laterally, you can clearly make out that the four bones, greater ring of sphenoid, frontal bone, parietal bone, and squamous temporal bone, they are unfused, and over here there is a gap. Now this gap is a future site of pterion. Now this gap is termed as sphenoidal fontanelle or anterolateral fontanelle. This will fuse at around the age of 3 to 4 months. Now below to that you can see portion of external acoustic meatus. Now bony portion of external acoustic meatus is underdeveloped or not developed just because the tympanic plate is seen in the form of a ring. Okay, in adult the tympanic plate is a triangular plate, but over here it is seen in the form of a ring, and so as the bony part of the external acoustic meatus is almost absent, and directly you can see presence of tympanic membrane which is directed downward. Let me bring it a bit closer, and you can clearly appreciate presence of tympanic membrane. See over here, a portion of tympanic membrane is found. It is partly perforated, but you can clearly appreciate You can also clearly appreciate underlying ear ossicles, malleus, incus and stapes. So this is the tympanic membrane. So the ear ossicles, middle ear cavity or tympanic cavity, internal ear and mastoid antrum, they are all developed adult size at the time of birth. So they are fully developed, whereas the external acoustic meatus, the tympanic plate and posteriorly lying mastoid process are not developed. The mastoid process will start developing in later part of second year, where the baby starts holding head and moving head, and due to traction of sternocleidomastoid, the mastoid process will develop. Now, as the mastoid process is not developed, the stylomastoid foramen, over here you can see it is found on the surface, and facial now will emerge out of it. So just behind this external acoustic meatus, the facial now will be exposed. So it is said that any surgery required to be performed just behind ear, say in the case of draining abscess, one need to be cautious about this facial now. Now posterior superior to this external acoustic meatus, somewhere over here, this is the site of McEwan's triangle or suprameatal triangle. The thickness of bone over here is just 2 mm at the time of birth, and then it increases in its thickness at the rate of 1 mm per year until it attains its adult size, which is approximately 12 to 20 mm in thickness, and deep to it lies mastoid antrum. Still posteriorly you can see a gap between temporal bone, particularly squamous temporal, mastoid temporal, squamous occipital and parietal bone. This is posterolateral fontanelle or mastoid fontanelle, which is a feature site of asterion, and this will get fused at around 1 year of age. Similarly, when you see it from behind, you will find a triangular gap between posterior part of sagittal suture and upper part of lambdoid suture, which is a future site of lambda. Now this triangular gap is termed as posterior fontanelle, which will get fused at around. Similarly, when you see it from above and front, you will find a large diamond shaped gap between meeting point of sagittal suture, coronal suture and frontal suture. The size may vary approximately 4 cm to 2.5 cm, and this is a future site of bragma. This gap is also termed as anterior fontanelle. So by and large there are such 6 fontanelle: anterior, posterior and on either side 4 lateral fontanelle, sphenoidal and mastoid. Over here sphenoidal and mastoid. Now what are the functions of this fontanelle? This will help in partial overlapping of all these bones during the parturition or during the process of childbirth, and that will facilitate easy passage of the head. Additionally, this fontanelle will also help in enlargement of the wall, because underlying brain is developing very fast, which will grow very fast for the initial first year, and the growth is steady up to 7th year. It is said that the vault will assume adult position at 7 years of age. Additionally, deep to this fontanelle in midline there lies superior sagittal sinus, so one can access the sinus through this, and laterally deep to these lateral angles there lies lateral ventricle. So sometimes it needs to access lateral ventricle, that can also be done over here. Similarly, per vaginal palpation of this anterior fontanelle will help in exact orientation of the head during vertex presentation. Similarly, when you palpate this fontanelle, and if it is bulging out, then it can give an indirect evidence regarding raised intracranial tension. Similarly, if it is depressed, then it is a sign of dehydration. Now this anterior fontanelle will get fused at the age of 18 months to 24 months. So maximum it will get fused at the age of 2 years. If it remains unfused even after that, then it can be secondarily to disturbed calcium metabolism due to vitamin D deficiency. Now the frontal tubers, you can see they are prominent, and so as the parietal tubers, they are very much prominent. These are the initial site of ossification, and the bone formation occurs centrifugally from this parietal tuber. and the four angles of these parietal bones will be last to fuse, and at four angles you will get frontaneles all around. Now when you see it from below, you can clearly appreciate that the foramen magnum is situated little bit in front, almost in the middle, and just compare it with the adult skull where the foramen magnum is situated little bit behind, not in the center. And this is just because the basi-occiput and basi-sphenoid, which will form clivus in case of adult, they are not joined with each other. You can see over here a primary cartilaginous joint in between, and at this joint the bone will grow, and that will help in increase in anteroposterior length of the skull, and gradually this foramen magnum will shift back. Similarly, you can appreciate presence of external occipital protuberance almost in the lower part, which will also shift little bit higher when the skull will grow anteroposteriorly. Apart from that, you can clearly make out that the condylar part of the occipital bone and the basi-occiput are also not fused. Over here you can see primary cartilaginous joint, and similarly posteriorly also you can see partially unfused condylar and squamous part of the occipital bone. So all four parts of the occipital bone are observed. Now this primary cartilaginous joint between basi-occiput and basi-sphenoid will fuse between the age of 18 to 25 years. So the synchondrosis will turn into synostosis, and meantime it will help in increasing anteroposterior length of the skull. So this is regarding neonatal skull. Hope you have understood well. Thanks for watching.